My name is Ella Dahlum, and in the year of 2024 to the year of 2025, there will be approximately 2,001,140 cases of cancer, which is approximately 5,480 diagnoses per gram. Many people have the question, what causes cancer? Is it something specific that we do as people? Is it genetic? While many doctors don't have the answer to that question, they can answer any questions you have about your treatment, remission, or anything if you do get diagnosed. So first and foremost, there's your diagnosis. They diagnose you with what type of cancer that you have, how rare, how aggressive or angry it is, and how easy it is to treat. Then you go into your treatment, which is a kind of sort of personalized plan for you, depending on what you want to do for your cancer. And then after your treatment plan, if it is successful or not, you will either go into remission/recovery, or you will go into hospice care. Cancer is a term used to describe a collection of related diseases characterized by their uncontrolled cell growth. The abnormal cells invade and destroy nearby tissues, which sometimes spread to the other parts of the body, which can be very dangerous for the host. There are more than 100 types of cancer, and some of the most common ones that we know of are breast cancer, lung cancer, colon cancer, and brain cancer has actually become more common in the past couple years than in earlier years. In 2020, there were 10 million deaths caused by cancer, which was the second most leading cause of death that year globally, not just in the United States. The various types of cancer can be categorized by where they develop in the body. So carcinomas, which are most prevalent, originate in the skin or tissues that line internal organs such as lungs, colon, and breast. Sarcomas arise from the connective tissues such as bone, muscles, and fats. Lymphomas and leukemias affect the blood and the immune systems. Each type of characters have distinct characteristics which influence treatment, treatment options, symptoms, etc. Treatment for cancer mainly involves surgery, radiation, chemotherapy, and immunotherapy, and also targeted therapies, depends on what type of cancer you have. Most of the time, your doctor is going to recommend surgery, if at all possible, to remove your tumor to prevent it from spreading to a different part of your body. And if it cannot be removed, you will head straight into chemotherapy just to help. So basically, chemotherapy is a drug that kills fast-growing cells, and it affects all cells in the body. So it affects your bad-growing cells while also affecting your good-growing cells. It affects any cell that grows. So that's where the hair loss, the fatigue, the bone loss, the bone and muscle loss in your body comes from. I'm sorry, I have a cold right now. Immunotherapy harnesses the body's immune system to fight cancer, which is just slightly different than chemotherapy. Radiation uses rays and high waves, such as an X-ray, to split the cells in half to help them not regenerate into other parts of the body, which is good as well. And the impact of cancer affects not just the person diagnosed, but also the family of the person diagnosed. So whenever the person gets diagnosed, it's kind of like the family gets diagnosed as well, because if they have a $4,000 hospital visit stay that they have to pay for, and their insurance only pays for, say, $2,000 of it, them and their family are responsible for that $2,000 bill. And those $2,000 bills can add up very quickly, because cancer is very expensive, because the drugs used to treat cancer are also very expensive. There's also emotional turmoil that comes with cancer and many, many other things. There have been many figures in the field of oncology that have literally turned the game around for cancer. For example, Mary Carey King discovered the BRCA1 gene, which is linked to breast and ovarian cancers. Her work has not only advanced cancer research, but it's also provided women with information about their genetic risk. So instead of women just not knowing, they know. So, in conclusion, cancer is a multifaceted disease that presents significant challenges to individuals and society. Understanding the different types of cancer and their treatment options is vital for effective management and future progress. Continued research, education, and advocacy are essential to provide outcomes for cancer patients. The fight against cancer is not only a medical challenge, but also a comprehensive social endeavor that requires collective effort and commitment. As research progresses and new technologies emerge, there is hope for more effective treatments and a deeper understanding of cancer biology, ultimately leading to improved prevention and management strategies.